So, I am super excited to share this information with you. This is information from one of my functional health patients, and I did get their okay to share this information. I am going to try to make it as kind of vague as possible. So I'm not going to say him, I'm not going to say she, I'm going to say they. Even though I do have their permission to share their information, I just want to keep it as private as possible. That's important. So, this patient came to me with body image issues. They wanted to lose weight and irritability. They just felt like they could work on that they were snapping with their children easily, and they really wanted to work on that. So, I want to share these health survey scores. So every month, my functional medicine patients are supposed to do their health surveys. Some of them are very diligent about doing them. Others I have to kind of hound. But it's really important that my patients do their health surveys because I do look at them. And sometimes if I see a score going the wrong direction, I'm going to dig into that. I'm going to see what's going on. So, with this patient, you can see that their first survey that they did was 3/19/2025, started with a score of 62. 190 is the highest score. So if they scored, I think 10 on everything. So there's 19 questions. Then they would have a score of 190. If they scored zero, on everything, they'd be a zero. So you can see that this person's score started at 62, went to 57, went down to 46. Then it went up here at 48. I do remember around this time, this person was having some struggles. So, one thing that they told me is that they'll start something new in life, whether that be a program or a medication, and it seems to be working for a while, but then all of a sudden it stops working, and they get really frustrated and just kind of like, stop what they're doing. They just give up. And that was kind of a trend that they saw in their own life. And then I also saw as well on paper the information that they gave me. So around this time, they were getting frustrated. And so we had a come to Jesus moment. We were like, okay, tell me why you're frustrated. Tell me how you're feeling. How can we resolve that? I even had this person come over to my house, and they came over for 3 hours and just rapid fired asked me questions about their health, about what we were doing with their program specifically. Any questions they had. I think I food prepped 2 or 3 meals during that time. So they got to see how I food prepped because I also am on the program. I'm also taking care of myself in this manner. So, and I'm having success. So, like, don't reinvent the wheel. Like, what is working? And then also, how we take care of people is based on their saliva test results. So it's not just like a cookie cutter program for everyone across the board. It's based on your test results. So, and then you can see that once we kind of like had that come to Jesus moment, the numbers started going down again. They are all down to an 8 out of 190 possible miserable points. And so I just wanted to share that with you guys. I'm so pleased. I'm so pleased for this patient. Yeah, it's just so exciting to see a patient come in that was fed up with everything that they had tried before, apprehensive about starting something new, even got frustrated in the middle of everything. But the thing that I really want to highlight is that this patient didn't just give up, didn't just toss in the towel. They communicated with me. And communication is so important because if I have a patient that is frustrated or feeling bloated or constipated, or doesn't know what they're doing or is confused, if you communicate with me, I can help you. We can definitely walk through things together. But if a patient throws in the towel, I can't help them. And I'm also not a bully. I'm not going to make them do anything they don't want to do. But if they just communicate with me, I can absolutely help patients. And I feel like I can help every patient, because we can rework things, we can retool things, we can figure out how to walk through that frustration It doesn't have to be a toss in the towel moment. So I just want to applaud this patient specifically, because I know at that moment they were like going to throw themselves off the cliff again, and that doesn't do any good. So I'm very excited to see yet another health score come in, and down to an 8. That's just absolutely amazing. So I might do a future video and show how Biocanic, this platform that we're in, how it works. I might use my own personal Biocanic account to show you guys, so that I am 100% HIPAA compliant. And yeah, if you have any questions about functional medicine, about our specific program, about Biocanic, about these health survey scores, just anything, I love to help my patients. So just let me know how I can be of help. Have a great day. Bye.